But right now, there are medications that can help to control that. Okay, that's a good thing of science, right? Okay, now look at the management, nurses. Okay, when the patient is taking these antipsychotic medications, it is also important for the nurse to monitor them for possible NMS. I don't know that, Mr. Rado. N for neuroleptic, and then M for malignant syndrome. Put a bookmark on that, and I will discuss that later. Now, one thing you need to understand is disclaimer in NCLEX. These antipsychotic medications, all of those that we have discussed, okay, the typical and the atypical, they increases the level of glucose in the blood. So if a patient is diabetic, so you would need to monitor the glucose level. Or even if they don't have diabetes mellitus, when they take these medications, there are some questions wherein the patients are having polyuria, polydipsia, okay, and polyphagia, not because they have diabetes, but because this medication increases the level of glucose in their blood. Okay. Now, for people who develops Parkinsonian symptoms, they may need a long-term medication to kind of control that. Although it's not for life, but it needs to be controlled. It will not go away overnight. It may need it. So it says may require. Okay, and then this can cause GI upset. So this needs to be taken with food or milk. And just like any other medications, you need to wait for a certain number of weeks before you can see the effect. And in this case, there says it starts from 3 weeks up to 6 weeks. I'll give you some tip. If you would notice here, the safer ground here is 3 weeks. Okay, the first one is the TCA is 2 to 4 weeks. The other one is 3 weeks. This one is 3 to 6.